this is just going to be a Basics of Medicare, Medicare 101, just to kind of go over what you need to know as you're considering what to do with Medicare, and whether you're approaching 65 or maybe you're working after 65 and you're just considering what to do. This is going to answer those questions for today. A little bit about me, just my background is I do have a law degree from the University of Texas. I've been doing Medicare since about 2016. So I'm the founder of Four Oaks Medicare Planning, and this is what we do every single day. I'm AHIP certified. That's just the certifications to be able to do everything needed for Medicare. As part of our agency, I'm licensed and independent. So I work with all the major carriers and have a lot of experience in corporate and HR benefits. So this is a very familiar topic for me, but for many people, it's not. And this is what many that I encounter almost every day feel like when you're looking at Medicare, getting all the calls, everything in the mailbox, the commercials you're seeing. It just feels like a big maze, and it doesn't feel very welcoming at all. And so part of the process that we're having this webinar today is to help you feel like that it's not a maze, that it can be a very straightforward process. And that's what I'm here to start helping you learn and understand, so it doesn't have to feel this way. So let's just go ahead and dive in. I'll leave time for questions at the end. I'm hoping this will be about 30 minutes, and so I don't want to inundate you with too much information, but I want you to have some familiarity with Medicare and build a framework today on what you need to remember, kind of think about, and then I'll leave time again for questions at the end. So let's just talk about what Original Medicare is. Original Medicare is what you get through the government when you go on the Medicare program. You usually go on the Medicare program when you're turning 65, but you might know some people that are already on Medicare that aren't quite that age. If you're disabled for a certain length of time or have specific illnesses, you can qualify earlier. But for most people, it's when you're turning 65 and you start getting all the mail, you know that something's going on. And that is Original Medicare. So let's just talk about Original Medicare is divided into two parts. You might see the red, white, and blue card. That's a standard card that you'll get when you go on to Original Medicare. So the two parts are Part A and Part B. Part A is your hospital benefit. So just think inpatient. When you go into the hospital and spend the night, that's going to activate Part A. Part B is medical insurance. So just think of outpatient. So when you go in for a diagnostic test, you go in for a doctor visit, it's usually going to trigger Part B. Now, what's important to know is Medicare A and B don't cover everything. It's hospital medical, but there's things that you need to be aware of. Number one is it doesn't cover all the costs for your medical care. That's something that's important to know. Once you go on it, you can have out-of-pocket and will have out-of-pocket expenses as you access care under Medicare. Part D is for prescriptions. That's D as in David. So I know it's another letter, but prescriptions are covered under Part D of Medicare, so not A and B. Routine dental and vision, hearing, like eyeglasses, hearing aids, are not covered under Original Medicare. It's important to know that Original Medicare isn't a long-term care policy type thing. It's not going to cover room and board like in a nursing home or an assisted living facility. And then also out of the country, care outside the United States, except for very limited circumstances. Usually it's really near the borders of the United States. You're just not going to have care under Original Medicare. So that's something just to keep in mind, that when you go on the program, not everything is going to be covered. So let's just talk about how A and B work. So these are this is for 2023. These will be updated in a month or so for 2024. But in general, things should stay similar to the costs and that you'll see here. Now, when you have your hospital benefit, that is Part A. Usually that does not cost anything. As long as you've worked 40 quarters, that's 10 years, and paid into the system, you don't have to pay for A. It's called premium free, Part A. Now, if you go access care in the hospital, you will pay a deductible under A of $1,600 in 2023. Just note that that says per benefit period. Just remember that's not an annual deductible. It means you can hit that deductible more than one time a year. And then you have per day costs after if you've been in the hospital a significant amount of time. And there is no out-of-pocket maximum under A, but I'm going to pick that up under Part B because that's a really important thing to remember. So let's just talk about and hit on Part B. Now, Part B does have a cost to it. The government sets this each year. This year, it's $164.90 a month. This does adjust up or down each year, so it will be different, most likely in 2024, but it shouldn't change significantly. It does say for most people, what I want you to remember is $164.90 is the base price. If you're a higher income earner, you can pay more for Part B, and we'll visit that in the next slide. But let's look at what happens when you go access care under Medicare Part B, the outpatient benefit. There is a deductible that you have to fulfill first, but it's fairly small. It's $226. And then after that, it's an 80-20 type of plan. 80% the government is going to cover, and then 20% you're going to cover for most covered services. So there is something called excess charges. That's just an extra amount that you might be liable for under Part B for certain doctors that want to charge a little bit more. B is not going to pay for that. That is capped at 15%. So there's just out-of-pocket costs in general is what I want you to know. And then just note on the right-hand side again, there's no out-of-pocket limit. This is something I want to spend a few seconds on because it's one of the major limitations of Medicare A and B. There is no out-of-pocket maximum. So if you have an employer plan or you're on a different plan, it likely is that if you pay a certain amount in copays, co-insurances, deductibles on your plan, if you hit a certain amount during the year, you'll hit what's called an out-of-pocket maximum. That just means after that, the plan is going to cover you at 100% for the remainder of the year. That is something that Medicare, original Medicare, does not do. So I just want to make sure that you realize that, because that's why you'll see all of the additional things come in the mail from all these insurance carriers, because there is something else that needs to be done so that you don't have your bank account emptied by that 20% in particular under Part B. So just note that these are usually called the gaps in original Medicare A and B, and we'll get back to how someone that goes on to Medicare deals with those gaps. But remember, I talked that the $164.90 is the base price for Part B, and it can go up depending upon your income. And so this chart basically is always updated every single year by the government, and it's going to show you exactly what you will pay for Part B in the event that you're a higher income earner. So you'll notice at the very top, it says on the top right, it says you pay in 2023, but look on the left-hand side, if your yearly income in 2021. So it's a 2-year look back that they're going to look at your income. So this year they're looking at 2021. Next year in 2024, they'll look at 2022, and it'll just go up from there. But you'll notice that if you're a joint filer under $194,000, it goes with modified adjusted gross income, or you're below $97,000 as an individual filer, look, you'll pay the base price, that $164.90. But if you go up in income, you'll notice that you will go up in how much that Part B premium is. It's no longer $164.90. The next bracket up, it's $230.80. So that's just something to keep in mind. Many people are just trying to figure out what to do cost and coverage wise with Medicare. And if you have been still working and you hit one of those higher brackets, just note that you could pay more for Medicare Part B. Now, if you go and you're recently going to retire, there is a way that you can challenge this number. Once you have the surcharge, you can challenge it based upon changing circumstances. If that's the case, you can always let me know, and there's a specific form that you'll fill out so that you can tell the government, hey, this is no longer, 2 years ago is no longer my income situation anymore. And many times you can bring that down again. But the main point is just know that there is an income adjustment based on income that could cause your Part B on Medicare to be higher. So here's some just really important things to think about, particularly for those that are going to continue to work past 65 or have continued to work past 65, so that you know about the penalties and things like that. That's something that I get all the time. You get all that stuff in the mail that says, go on Medicare, you're going to get penalized, don't get penalized. Now that can be the case, but under certain circumstances, you don't have to worry about penalties. And so let's talk about that. So there is a late penalty. It's 10% for Part B for every 12 months you're not on Part B. Once you approach or you're eligible for Medicare, particularly at 65. But just note it says unless you have qualified other coverage. So let's talk about what that means. For many people, that means number 2, employer health insurance. If you are working and you want to continue to work past 65, you can continue with your group employer coverage and not be subject to any penalty. And that's something really important to know. If you have group coverage and it has a drug plan on it and you get your hospital medical, in general, you're not going to be penalized if you continue to stay on that plan. But there is some caveats to that. I call these some gotchas that you're going to want to remember. Now, if you're with a large group employer that is 20 or more employees, Medicare is designed to be secondary to the employer plan. So that's why you can stay off of Medicare, because if you go on to Medicare, it's going to be secondary to your employer plan. Your employer plan will remain primary. And so many people will do that. And there's not going to be any penalty assessed, because as long as you're an active employee and continue to have that coverage. Now, note that if you're with a smaller company, less than 20 employees, Medicare is designed to be primary to the employer plan. That is a scenario in which you likely would want to go on to Medicare A and B, because it's designed to be primary to your employer plan. So just remember that employer size matters on what you do with Medicare once you become eligible. Now, let's say you're with a large group employer plan and you contribute to an HSA account, a health savings account, because you have a high deductible health plan that qualifies, and you're paying in that HSA and accumulating money at at a tax benefit as well. Be aware that no matter what, you'll want to particularly if you're with a large group employer, you're going to want to stay off both Part A and Part B. Any part of Medicare will allow you not to qualify for making HSA contributions anymore. They become ineligible. Now, where would this factor in if you're with a large group employer? Well, remember Part A, the hospital benefit, is premium free, and it's secondary to a large group employer plan. So that just means that many people will decide to go on to Part A, no additional cost, and it will give you secondary hospital coverage, which is nice. In the event you have a hospital event, you could have Medicare come in under Part A and pay part of that. So you can do that, but if you're contributing or want to contribute to an HSA, you would not want to elect A or B because of that reason. Now, if you've continued to stay off A and B and well into past your eligibility for Medicare, and you're continuing to make those HSA contributions, be aware that, here's a gotcha, HSA's contributions should be limited and stopped 6 months prior to going on to Medicare Part A. Why is that? Because Part A, for whatever reason, is retroactive up to 6 months. Up to 6 months or back to your birthday month when you turn 65. So just remember that. If you're 67 and that's when you're going on to A and B, A will go back to 66 and a half. So just remember that. So you'll want to stop those contributions 6 months earlier so that you're not caught. with making ineligible contributions. I have veterans that ask me all the time, what do I need to do with Medicare? You don't have to go on to Medicare if you have VA coverage, but beware, it's not creditable to Part B. That means you could have a penalty of 10% per year if you decide not to go on to Medicare when you're eligible. Finally, COBRA benefits. This is really important as well. COBRA is not like active employee insurance. If you leave your job and you elect to go on to COBRA and you're eligible for Medicare, it does not extend your time period to go on to Medicare. You need to go on to Medicare because COBRA is not creditable to Part B, and it could subject you to penalties if you wait too long. So again, I'm not expecting you to remember all of this. I just want you to think of some key words today: VA, COBRA, HSA. If you have questions, obviously, I'm going to give you my contact information at the end of this, and you can always contact me to make sure that we talk about your specific situation. But these are the gotchas, and you don't want to get caught here. So remember, A and B doesn't cover everything. And so this is why it's important to know, well, why am I getting all of the stuff in the mail? And what are these options about? And so now you know why. Because A and B are, again, just don't have everything that you would need. And insurance carriers are allowed to offer products that are regulated by Medicare. And so it can get really, really confusing. But what I want you to think about is there's really only two options that you choose from when you go on to Medicare. And it's divided. You can choose between what's called a Medigap plan. It's also called a Medicare supplement, or you can choose what's called a Medicare Advantage plan, also known as Part C. So let's look at the first one, a Medigap plan or a Medicare supplement. You'll notice at the bottom left, it says you can add supplemental coverage. So this is exactly what it sounds like. It supplements A and B. Those things, remember, that we talked about, the 20% under B, the $1,600 that you have to pay for under A. A Medicare supplement's designed to come in and pay almost all of that for you. Okay, so this is a really overwhelming chart, but I want to break it down so that it makes sense. This is what a Medigap plan, the Medigap plans are. Of course, the government makes it as hard as possible, so they give us more letters. We have now G and N and all those things. But let's just talk about what this chart represents. If you look on the left-hand side where it says benefits, those are just the gaps. Remember the gaps I talked about? Look at Medicare Part B, 2 rows down, coinsurance. All that means is that's the 20% that you'd have to pay for under original Medicare. You look down a little further, Part A deductible, that's at $1,600. So you'll notice that that's just the gaps that you would pay if you did not have a Medigap plan. Now look at all the percentages. I want you to go to the column that has the G at the top and just look at all the percentages as you slide your eyes down that column. They say, most of them say 100%. So that just means how much of the gap that plan is going to cover for you. So in the event that you have the 20% coinsurance under Part B, under original Medicare, the Plan G is going to come in and pay that 20% for you at 100%. It's going to cover all of it. And that's all that chart is saying, is how much of that gap is going to pay. And you'll just notice, you'll see under the G plan, there's only one that has no percentage inside it. It's completely blank. You slide your eyes over, that's that Part B deductible. Remember, the Part B deductible for 2023 is only $226. So you'll know that under the G plan, anything that's covered under Part A and Part B, after you pay that $226 under the Part B deductible, you're going to have 100% coverage between A and B and what it pays, and then what the Medigap pays. So that's the beauty of what a Medigap plan does. It gives you almost 100% coverage. People really love that. It's just not available in anything other than Medicare. And so just note on the right-hand side, it's really important to remember this little fact. Just kind of think about it when you think of Medigap plans. When you're going on to Medicare Part B for the first time, you have what's called an open enrollment period. It just means that you don't have to answer any health questions. You can get one, no questions asked. And that's really, really important because later on that window will close and you might not be able to get it due to your health status. So just remember it's an option there for you to consider, and a good one as well. We're going to go back to this chart on the left-hand side because I want you to say that's what we just looked at, adding the supplemental coverage. If you look right above there, you're going to notice that it says you can add a Part D plan. Remember, that's drug coverage. The reason it's there is because if you remember, I said that the Medigap plans only supplement A and B. Remember, drug coverage, Part D, if you remember that from earlier in the presentation, is not covered under A and B. That's why the supplement doesn't cover it either. So at that point, we would add what's called a standalone Part D drug plan so that you could get pick up prescriptions at your pharmacy. So that is what I call a buy-up option because you pay an additional premium for a Medigap plan. And those premiums just vary depending upon what type of Medigap plan you want, but they're very affordable for many people, and and it's a good way of really setting your coverage in place where, you know, the more you access care under Medicare with a Medigap plan, doesn't mean you pay more bills. Those things are taken care of by those two policies. So let's look at the right-hand side now. Medicare Advantage Part C. This is the second option. It's completely different than the first one, the Medigap. The second option, Part C, is where everything's bundled together. Think of your employer plan, the type of plan you have now. This is what a Part C plan looks like. Essentially, a company is going to bundle all of your coverage together. They're going to give you your A and your B. Most will give you your Part D as your prescriptions. And they'll offer extra benefits as well that Medicare doesn't cover, like I mentioned before, dental, vision, hearing, other things. Many of these plans they all have out-of-pocket maximums, so you are protected there as well. And many of these plans, you can pay as low as $0 for these types of options. It just means it's a more budget-friendly option. If you don't or can't afford the buy-up, you can do a Part C plan that offers a lot of nice benefits, and it keeps the budget in check because you're not having to pay many times extra premiums for that plan. And like I said, they'll bundle everything together. These are network-based plans, so they'll be like a PPO, an HMO, those things. Similar, like I said, to your employer plan that you might have today. So it's really important to make sure your doctors and your prescriptions, there's lots of options under Part C. If you go this route, you know, we'd want to make sure all of that is covered for you so that your coverage is comprehensive. Now, I'm not going to read this chart, but I really want you to know, sometimes people ask, well, what is best for me? And it really just boils down to cost and coverage. If you really want to limit your cost on a monthly basis, a Medicare Advantage plan might be better because it doesn't have usually much of a cost with it. If you like the idea of almost 100% coverage, well, you might be a Medigap person when it comes to Medicare. When it comes to the Medicare Advantage plans, it's going to be more like what you're used to. You won't have everything covered at 100%. You'll pay co-pays, co-insurance when you go to the doctor and things like that. So again, this kind of gives you just a little eyeball of the positives and negatives, but it really just boils down to cost, coverage, and convenience on what you want. So remember I talked about prescription drugs, that's Part D. The government, when it comes to Part D plans, I will tell you, it really specific to your medications. You always will pick one of these up between either a standalone drug plan, usually accompanied with that Medigap option, or it will be bundled in with the Medicare Advantage plan, that Part C option. So just, you know, within that two choices that you have. I tell people all of the time that I always recommend have someone help you here because, you know, you can, depending upon your medications, there's different options. You just want to get the plan that you pay the least and it covers your medications. I just want you to know that this is a confusing area. If you have certain medications, you might pay more at a certain time of year, and then later in the year, you might pay a different amount. That's because you go through stages, and you'll notice those stages on the right-hand side. But like I said, it's very specific to your needs. And for the most part, I would just say you just want to find someone that can help you make sure that your drugs are covered, they're in the lowest tiers possible, that they're actually on the plan in the formulary. And those are always things that I can help you with. So let's talk about when do you enroll during different parts of your life on, based on the decisions that you've made on continuing to work or not. So generally, you'll know that there is what's called an initial enrollment period. That initial enrollment period is a 7-month window. As you're approaching 65, it's 3 months prior to your birthday month, includes your birthday month, and then goes 3 months after. Generally, if you're ready to go on to Medicare, this is when you're going to do it. And typically, people are going to do it within the first 3 months because you want to slide into Medicare on the first of your birthday month. Now, just note that if your birthday is any time between the 2nd and the end of a particular month, Medicare will always begin at the first day of your birthday month. If you happen to be a first of the month birthday, you'll get an extra month, and it will go into effect the first of the previous month. And so just be aware of that. If you're drawing Social Security, you do not have to enroll. The Social Security will enroll you automatically. If you are not enrolled in Social Security, you will have to enroll into Social Security for Medicare. That does not mean you have to get your Social Security benefit. You can delay that decision, but Social Security does handle Medicare enrollments before then CMS, which is the government agency that regulates Medicare, takes over for actually your benefits. So remember, this is the time period where you'll avoid the penalty unless you have other qualifying coverage. Now, remember that other qualifying coverage is generally going to be someone who works past 65. You might be in this boat. And so I want you to notice that you do have an 8-month window, a special enrollment window that will open up in the event that you decide to work past 65 and elect not to go on to Medicare at that time. But note that most of the time you would want to set everything up prior to that first month. Why? Because when your employment is terminating and your employee coverage is terminating, you're not going to want to wait into the 8th month to start your Medicare. You're going to want to do it before, so that as of the first of the month, you're transitioned fully onto Medicare. But I just do want you to know that you do have an 8-month window in case you're behind. But always, again, you can contact me. I'll make sure that you're not going to miss this. Again, note, COBRA does not extend this window. It's active employee coverage. So make note of that. If you do want to go on a drug plan or a Part C Medicare Advantage plan, note that your window is smaller. So just be aware that you might have 8 months, but you don't have 8 months to enroll in some of the other options we discussed today. Okay, you're about to see on the television a bunch of commercials for Medicare, even more. This is because there are different times of the year that those that are already on Medicare can make changes. So remember, if you're not on Medicare yet, this is really, this is going to be a little bit for those that are already on Medicare, but let's talk about what these other election periods are so that you just know what's going on. The annual election period is coming up. It's between October 15th and December 7th. This is when you can enroll in, change, or disenroll in a Part D standalone drug plan or a Medicare Advantage plan, Part C. So all new benefits change each calendar year. This is the time many people will go in and review their coverage and make different elections for next year. So just be aware of that. If you're approaching 65, this is not really applicable to you. You go back to your initial enrollment window, that 7-month window. Now, there is a general election period. If you or someone you know just forgot to enroll, There is the ability to enroll later. It's called the general election period. It happens between January and March of each year. And so just be aware that there is that opportunity to enroll in Part B if you missed that window. Hopefully you didn't, and you fall into one of these other categories, because this is generally where you'll notice a lot of times that's where a penalty will be, because many times people didn't enroll at the time that they were supposed to. Okay, so I know that this was a lot of information and you just may have some additional questions. What I want you to know is that I try to make myself available to answer questions and really help anyone that would like to understand Medicare a little bit better. My website is goforoaks.com. You can write that down. My services are always free. I never charge anything. A calendar link will appear on my website just after a few seconds. And if you would like a quick little 15-minute call with me, I'm always happy for you to schedule that. And then I'll call and we'll talk. This is also my contact information, my phone number, my email. Again, you can jot this down. I'm local to Austin, but I do work all over Texas and throughout many states across this country. But I do have a local office in Southwest Austin as well. And we do put out lots of resources each year. You'll notice this little survival guide on the right-hand side. It's just a resource that we make free and available for anyone who would like just a little guide just to help them remember some of these enrollment periods and the information that we talked about today. We will be updating this for the upcoming year as the government updates all of their numbers for 2024. So we're always happy to oblige and make these available as well. So I just really appreciate you joining today. And I'm going to open up questions at this time. If anyone has any questions that they would like, you can put them in the chat or you can unmute, and I'll take any questions that you have for me today.